Hey there, it's Dr. Craig. Today what I want to do is I want to show you how you can help yourself to maintain your pelvic corrections as best as you possibly can between adjustments. This is by no means a replacement for your chiropractic adjustments, but what it will do is it will help to maintain that correction, and it also help to maintain the muscle activity around the pelvis. So by getting started, what you're going to need is maybe like a yoga strap or even a fashion belt that you would wear around your pants, and also maybe a yoga block. You could also use maybe a firm throw pillow or even a foam roller. Okay, let's get started. So we're going to start off by laying on your back. What you're going to do is you're going to bring your knees up, your feet off the floor. With your hands, you're going to press down on the top of your left knee, and you're going to pull up on the bottom of your right knee. To do the movement, you're going to pull your knee up towards the top of your head while simultaneously pushing down with your left hand so that there's a resistance. On the other side, you're going to push that opposite knee down while pulling up with this hand. So it looks like this. You're going to push and pull and hold for about 3 seconds. Then you're going to switch hands. You're going to push it down with your opposite knee while you'll simultaneously try to lift your opposite knee up. Again, you're resisting, so I'm pushing down on my right knee while I'm pushing my right knee up. And I'm pushing my left knee down while I'm pulling my left hand up. And we're going to hold each position for about 3 seconds. So we're going to switch. I push, I pull, I resist. I push, I pull, I resist in the opposite position. And I'm going to do this 3 times on each side. And finally, the last one. When you're doing this, you only need to use about 15% of your effort. It doesn't need to be a real rigorous type of movement. Next up, you're going to grab either your yoga strap. In this case, I've actually just got a fashion belt. And what I'm going to do is I'm going to pull my feet together on the floor. I'm going to wrap the belt around my knees. And here, I can actually tighten it. I just put it on the loop. And what I'm going to do is feet together, I'm going to push my knees apart, trying to break the belt. And I'm using, again, about 15% of my effort. I can really feel the muscles working in my glutes. I'm going to hold that for 6 seconds. Then I'm going to relax. And I'm going to open the belt up a little wider. So I'm going to take it right to the last rung. Knees are open. My feet are still together. And I'm trying to push my knees open again. I'm going to hold that for 6 seconds. And relax. And then finally, I'm going to open my feet apart. And I'm going to keep the belt open. My knees are open. And now I'm going to finally just do one more push for 6 seconds. Feet apart, knees apart, push and hold for 6. Great. Okay. Now, we're going to put the belt aside, and we're going to grab either a foam roller, maybe even a yoga block. A book could work. A good firm throw pillow could work. Again, what we're going to do is we're going to start off with our feet together, your knees together. And what you're going to do is you're going to push your knees together for 6 seconds. 4, 3, 2, 1. Then I'm going to take the foam roller and I'm going to put it between my knees. My feet are still together. My knees are now open, but squeezing against the foam roller. And I'm going to push together for 6 seconds. 4, 3, 2, 1. Good. And then finally, I'm going to open my feet apart and I'm going to put the foam roller or the yoga block. I can put it lengthwise between my knees. I want it spread out about 6 inches apart. And again, I'm going to feet apart, knees apart. I'm going to squeeze together for 6 seconds. 4, 3, 2, 1. Terrific. That is all you need to do. What this is going to help you to do is to get the position of your pelvis so that the pelvic bones and the structures around the pelvis are as best aligned as possible until you can get in to see us. But it's also going to turn the muscles on around the pelvis, and that's going to help to support the correction that you've just attempted to try to create. Okay? Try this. If you have any questions, please don't hesitate to reach out.